Hello, and welcome to the Postpartum Years podcast. This is part 2 of our Diastasis series. I am your host, Dr. Mary Ellen Kramp. I am a physical therapist and a pelvic health specialist. And joining me today is Vanessa Pinkham. She is a Pilates instructor and an instructor of instructors and a personal trainer and lots of other things. Welcome, Vanessa.
Thank you so much. It's a pleasure to be here. Can these can a DR exist in a male body as well, and the pelvic floor dysfunction?
Absolutely. In males, it's usually tied to obesity.
That's where I've seen it in excess body fat.
Right. Because for a woman, if the fat is more distributed or it's more like in the hips and thighs, that's not going to play into it. But if it's more visceral fat, if it's more around the internal organs, that's pushing the muscles out and away from each other. So that's when a man will tend to get a diastasis. The other one is if they've had abdominal surgery where they've, gone through that connective tissue in between. And then that splits because they, tried to do too much too soon, or they've, got just a little bit more visceral fat than they should, then that's just a weakness and that will split that way. So those are the two main cases where a man will have a diastasis, but typically for women, it'll happen with pregnancy, and it doesn't matter if you delivered vaginally or C-section.
It can still be present.
Yeah, it'll still be present because often it's above. And one thing I had found recently, because I also teach a breast course, I was talking to one of my patients about how the rectus abdominal muscles attach onto the lower ribs, and the connective tissue from that blends in with the connective tissue from the pec major. So you have the pec major, the chest muscle, the rectus abdominis, the abdominal muscles, and their connective tissue blends together and forms what's called the circummammary ligament. So this is a ligament that kind of helps to hold the breast tissue in place. So it keeps the breast from sliding down as a unit. I'm not talking about flopping forward.
Different.
Because that's very different, but the entire breast itself doesn't slide down, and it's that circummammary ligament. And I'm actually doing research on this right now to see where I can, with ultrasound, check the width of the linea alba, that space in between the rectus muscles, with the ultrasound. So I assess that and then treat that circummammary ligament to see how much of that is creating some of that separation.
Ooh.
Because I watched one patient I had where I was discussing that with her. I'm like, oh, I need to treat that. Let me try treating that. And I treated that on her, and they slammed closed. I was so excited. So I'm like, okay, so now I have to do this in like serial patients to see how that changes. It's not going to work in everybody, I know, but she was also very sore around that ligament, which I thought was amazing.
That's fascinating. And then extrapolating that out to me as someone who is looking at it from a strength and conditioning perspective, as a Pilates teacher, what I wish was more greatly understood. And I feel that it is a trickle-down effect of girls going through puberty and not loading their tendons and their ligaments to the same degree that their male counterparts do often in sports. And then going through their 20s and perhaps seeking to be as lean as possible, but severely undermuscled. And then now we have a population that are increasingly having babies later and later in life. And they are arriving at a muscular and ligamental state that is underloaded, underfed, high stress. And then they're arriving at the opposite side of that and wondering why it is so hard to recover from having a baby. And in the same way that a low load is going to create a low adaptation, they then seek out low load stimulus to try to correct what was a massive stimulus of childbirth, whether it was a C-section or whether it was a vaginal delivery.
Right.
And so in handing a student, their baby is 6 months old, hitting around 25, 30, 35-pound mark, and they'll look at me and say, oh no, I can't pick up that weight. You do it with a twisted spine, one boob hanging out, rotating over a bassinet in the middle of the night, and your back is great. So allowing them to start to progressively load their tissue from multiple ranges of motion and getting the basic meat and potatoes of traditional strength training into their bodies, it is incredible the structural change that can happen in a woman's body. And then incredible still to see the aesthetic and the shape change as well. So it's hard to say that as a Pilates instructor because it seems like sacrilegious to say, I think that you should treat your Pilates like dessert, in the same way that a person should not keep coming to you as a patient once you've cleared them to go back into normal movement. Mm-hmm. We should see things that have a low stimulus as in the case of Pilates, we're feeding our movement patterns. We're feeding our proprioceptive awareness. We're feeding our knowledge of our place in space. But if we're looking for a big change in the structure, we have to match it with an equally big load, appropriate for the body, but one that gets progressively more challenging so that your body continues to grow and adapt. So in the case of, hypothetically speaking, patient X, physically super active, really fit, lean, 4 months postpartum. They come to you. They're coughing, sneezing, laughing. They go to get back to working out, jumping rope and power cleans. They pee their pants every time. Mm-hmm. You assess them. You work with them clinically, ultrasound, manual therapy, give them a program. You get them through and you clear them. What would your advice be to that patient now that they are on the other side of what was the effect of their pregnancy on their body?
What I usually say to them, because I have so many that are just either fearful that they'll never, ever, ever get back to running or, any sort of exercise. Yeah. And then I have the other extreme of they want to jump straight into, well, I had been squatting 200 pounds, so I want to immediately get back to 200 pounds. I'm like, can you start with just the bar?
See how that feels? Make sure everything stays where you want it.
Yeah. And just do that for a session. And then if that went great, the next time add 20 pounds to it. And then the next time, and I really like people to build back in and not just jump straight into it. And also I have to let some people know that, okay, well, you did this entire class, but you started peeing a little bit at the, a little bit of dribbles at the very end. Okay, well, there's an endurance component to it too.
You exceeded the load that you could handle.
Right. For that period of time. Oh, and speaking of period, I also try to warn them that as they cycle through, when they hit PMS, especially the closer they get to their periods, things can just kind of get really weak. So they'll feel like, oh my God, everything came back. I'm backsliding. Nothing, I'm never going to be able to.
all my progress.
Yeah.
And this is when they said this is their luteal phase. This is toward their period.
The end of the luteal phase. Okay. So the
progesterone's rising, or this is before their period?
This is right before the period. So the progesterone is actually starting to drop. So the progesterone's been high. It's now starting to drop. And so once the progesterone drops to a certain point, that's when the period starts. So it's kind of in that little phase there where everything just kind of gets weak. So back in when I first took a pelvic floor course, as PTs, we learn how to do techniques on each other.
Oh,
So
wow.
we were learning a pelvic floor assessment. We're sit and lecture, and then it's time to learn how to do it. Well, one of us strips and gets on the table, and the other one is the therapist and
Okay.
practices.
You
And
got
then
to
we
know each
talk.
other really well.
Yes, it does.
Mm.
You learn to,
Welcome to medicine.
yes, to let those Catholic parts of you go. Let that shame just go, because you're just going to be flapping in the breeze on the table
Oh,
with
goodness gracious.
a coworker, just the finger in your vagina. So the first day of the course, this was like a 4-day long course. My strength tested out at 5 out of 5. And then day 4 of the course, when we were assessing again, all of a sudden, it was like a day before my period, and all of a sudden my strength is like a 3.
Ooh.
And we had learned in the
Ooh.
class that yes, pelvic floor strength will fluctuate with your period. And I was like, dang, that was significant. And I was really glad I was kind of at that point in my cycle where it was thrown into my face, because I'm like,
Yes.
I know how to contract. I can contract this. And it was crap. It was just
You
utter
might,
crap.
your body's saying we're stripping this lining, we're going to bleed. Okay. And
Yeah. And now we're just going to relax. We're just going to
mm.
take a break. So, yeah, I need women to understand that when they're close to their periods, or the very first part of their periods, it's that if you're going to have problems, that's when it's going to be. And that's okay. And give yourself
Yeah.
that grace. Maybe not go lift weights and do
Don't
squats
max
and
out that day.
right,
If you're in the cycle of rebuilding pelvic floor function,
right,
don't expect to be able to max out 2 days before your period.
right.
This is a very big wave. TikTok, Instagram. Um, there was a lot of fear put into women that they needed to sync their cycles to their workouts. And then women who don't know if they ovulate or they haven't had a regular period in 20 years,
Mm-hmm.
then became neurotic, even more so about whether they should or shouldn't train with intensity. And I don't think that's what you're saying at all. You're not saying
No,
stop your workout entirely, but really and truly auto regulate
right.
and see if you go to pull 145 off the ground and it feels like 200 on the third or fourth rep, and you feel like you're going to fart and you can't hold it in, your body's telling you something. You've exceeded the
Exactly.
threshold, and there's nothing wrong with that. Give it a couple of days and things will start to level out again. I think I like what you said before, in that if you were used to doing something, yes, you've had your baby. Yes, you might be 4 months, 6 months, 8 months postpartum. Maybe your period is even back. But to go about it with a long range goal in mind I like to think of it as stimulate and not annihilate every session, because it's unnecessary, one. And two, it doesn't in clinical research, if you're working out at an RPE, or a rate of perceived exertion, of 8, 9, 10 every exercise, well, then on the other side of that, you're going to have the CNS repair and recovery that will kick the can down the road before you back to where you were here. Where if you go in at about a 6 to 7 and you stay consistent with that for a longer period of time, the outcome is way greater.
Mm-hmm.
So something that I was thinking about while you were talking, in in the instance of I get a patient from you, or I get a referral from another clinician, and the patient begins to tell me that they are again experiencing incontinence, urgency, so on and so forth. They're symptomatic again. Do you want me to? My inclination is to step back and send them back to you immediately. That is the response. That is the ethical response from my perspective, because I'm not a PT. I'm not going to pretend to be one. So for the new Pilates instructors that are listening, the ones who have the same class attendees, they get to know them, they get to understand them, they've read their intake paperwork. Is it what I'm looking for you to say is to give them the pass that they do not have to pretend to be a clinician, that they can step back and say, I'm going to refer you out, and here's why. The patient will sometimes trust the Pilates instructor more than they will the doctor, which is crazy, but it's just a matter of camaraderie, emotional attachment, etc. What verbiage, or how would you like the Pilates instructor to communicate to that patient that they need to go back to their PT to be assessed? Long-winded way of asking that question, but I want these young gals who've been teaching reformer Pilates for a year, 2 years. That's the average right now. I want them to know and understand that they do not have to have imposter syndrome ever if they stay in their lane.
Right. Right. What I would recommend to any new instruction, any exercise instructors, any personal trainers, yoga instructors, I don't care, whatever you teach, get to know the pelvic PTs in your area, because we want to know you too. I want to know who, and I haven't met my Vanessa yet here.
I'm trying to make minions.
Yes.
I'm working on it. So give me time, because it's coming. It's coming.
So if you're in the DC area, if you're in Montgomery County, Maryland,
I've got
let me know you
coming.
exist. But yeah, whoever you are, get to know the pelvic PTs in your area, because we do want to know you too. We want to know who we can send our patients to. I want to know everybody in my area that it's like, how do you teach your classes? What do you teach? Because, okay, so hot yoga, not my thing. Like, I just think that's ridiculous. But I have patients that love that.
I do too.
And I want to know those hot yoga instructors, because I want to say, hey, go see Beth. Beth, teaches this sort of class. Or I want to know another class that we did when I was teaching or learning yoga as to be an instructor.
Yeah.
We did a power yoga class one day. And because she brought us through all sorts of different classes. And then at the end of the class, we would discuss the aspects we liked or didn't like about what we were doing. And she was playing hip hop music through it. And I was like, oh my God, I hate this class. I hate it. I hate it with every bit of my being. This is anti-yoga. And so we finished the class.
I love classes like that.
We finished the class and she goes, okay, so what did y'all think of this class? And people are like, oh my God, that was exactly what I needed. Oh, I feel so centered now. And I'm listening to like person after person after person in this room talk about this. And I'm like, what the hell? What are you talking about? And I raised my hand, and I'm, of course I don't look like the typical yoga instructor in the class as it is, but I am just going, okay,
which is bothersome to me, by the way.
This was anti-yoga. I am so freaking angry right now. I am more angry now than driving through Tampa traffic to get here.
That's amazing. That's a great story. And I know you, so I can just imagine you in that setting, which is while you were talking, I'm like, my cheeks hurt. I'm holding it in.
Yes.
It's awesome.
Yes.
Yes.
Yes, Vanessa knows me well because she was my Pilates instructor. So yes,
first.
So she helped me actually through a lot of postpartum stuff from a really, really bad third delivery incident that I had. And so it was, I know her side of things very, very well, having been through it, and very, very grateful for everything that she taught me, even though I'm a PT and I'm supposed to know all that crap. And we don't know all that shit stuff.
That's fine. It's real. But that's the thing, is that, like, okay, as a Pilates instructor, I'm deeply immersed in my craft. And at this point of the game, I'm not going to like Pilates on the ball workshops. I'm doing clinical courses. I'm doing courses for PTs, because as a private instructor, I'm kind of a rare breed now, and I get a lot of clinical referrals. But I'm going to stay in my lane. What I do is not good enough. It is fantastic. And knowing that by not pretending that I'm a doctor, not using terminology that gives a little hint of leverage that I do not have the educational background to back up, and rather leaning on my training and then outsourcing what I don't. To me, that is truly being a member of my community. It is weaving and growing a tapestry of care that is really hard to navigate for a patient. And it is creating connections like this that are now across state lines that let us expand out and rise the educational quality of an industry that is exploding. And it is exploding with neophyte practitioners and educators, neophyte, brand new, beginner, just starting out. And so by saying, as a Pilates instructor, a clinical Pilates instructor of 20 years, I never cue the pelvic floor. And here's why. Jaws drop, pearls clutch. But, I can't wait to teach these workshops. It's the ultimate bait and switch. What pelvic floor cue you should always use and which one you should never. All of them. 2 hours later. I don't know. Maybe you should let him edit that out because it's going to like kill my whole spiel. But no, you've got our local fantastic studio. I think they're churning out like 200 instructors a year.
Wow.
In Reformer One, and that is only in Tampa, Florida. Austin, Texas, New York City, California, Portland, Park Cities. Think of all of these places where you have a practitioner like you saying, go to Pilates because it's going to help your abdominals. It's going to help your pelvic floor. It's going to help your back pain. Is it? Is it?
But yes,
it's
I think
going to be
so.
based. Yes, but it's going to be based on the quality of the instruction.
Right.
And the quality of the instruction is going to hinge on people like you communicating what you know through years of clinical practice, and then someone like me communicating what I know through years of working with clients, and then being able to draw on knowledge from people in medicine like yourself.
Right.
So it's a fun time.
Yeah. You know, you talked about the neophytes and in Pilates. We have the same thing in pelvic PT. 20 years ago, when I was starting, pelvic PT was in its infancy, and it's really exploded in popularity. And unfortunately, there's a lot of people who've taken one course and they have the time to market themselves, or they're really good at marketing themselves.
Yes. And they look good.
Yeah, and they look good.
And they edit videos beautifully.
Yep. So they are, they're really getting the word out there, and they don't necessarily know all of the nuances of what needs to be done, just same as you're alluding to in the Pilates world. So, for those looking for people in the field, also look at their experience, find out what courses they've taken. Like, I'm personally a visceral snob. I really like the hands-on stuff. I really like working with the bladder, working with the bowel, working with the uterus, and really getting into the connective tissue in such. And it's a very different treatment, very different mindset than somebody who is doing there's telemedicine pelvic PT out there.
Oh, honey. Wow. But it goes to show you how desperate the patients are for help.
Yeah, but that also tells you how, like, Blue Cross wants to manage pelvic PT. Yeah, we'll give you free pelvic PT. We'll do it through telehealth.
Wow.
Where, how can you assess that pelvic floor through a monitor?
That's insane.
Without touching the patient.
Makes me snarly.
Yes.
It's not my field. But I am sent reels. I am not on TikTok, but I am sent reels from my clients of women, postpartum women, you see their top 3 pinned posts are themselves with their children, themselves in a bathing suit, themselves exercising. That's the typical catch. And then videos of themselves contracting their abs. The bra's here, the pants are here, and you're seeing the very lean body, a very visible abdominal fibrous connection, contraction, and so on. My response to a Pilates instructor just this past weekend who sent me that, watching a couple of her videos, was, I wonder if she can hold in a fart. That was my response. And she replied, cackling. And then I decided to get her attention. And then I explained that you have no way of knowing that what that person is experiencing after 3 babies is functional, healthy. And the important thing when looking at an influencer who is promoting pelvic floor health and exercise is, do top pelvic floor PTs follow them? Does anyone in medicine follow them, or are they only followed by your friends and other influencers? And that's the red flag. Mm-hmm. So that's what I look for. As soon as I get a link from someone, I immediately see, so, no, okay, I'm out.
And we're going to wrap that up for today. I know we have a lot more to talk about, so we will be with you again one more time. So we'll see you next time on the Postpartum Years podcast. Thank you.